Hello there. Welcome to the last part of our course all about torque. Of course, you know that about torque we have many other informations, but if you're just keeping our course based on all information that we can put on this course, we would have like should talk for 1, 2, 3 years, 3 years or more. I'm kidding, but I think you know that we are basing everything on the basics. We are talking about the basics of the torque. We're talking about how to deal with the majority of the torques that you are going to apply in your daily practice. And you see that in your routine, you're using this information. I hope you do. I hope you do. And I hope you come back to me saying, what do you think about it? Didn't it change the way you do things in your office? So give me this feedback, please. I'll be here for you. Let's go to the last part. Let's talk about the individual torques and some torques for finishing our treatments, okay? Let's do it. Regarding the individual torque, I have some tips for you. First of all, if you're applying torque using a bracket like this, ceramic bracket, don't try to do that. Don't do that in your home. Don't try to do that using stainless steel. It's not going to work. The bracket is going to break. It's going to be, you can't give to that torque, to that bracket, a good torque and a good and effective torque. Why not? Because you remember that the magnitude of the couple is based on one force, one of the forces, because they are equal in magnitude, one of the forces multiplied by the distance between those two forces. Since we have inside the bracket a very short distance, we need to have a very, very high force, because we don't have a longer distance between those two forces. And in this case, if we are applying a very large, very big force, very strong force here to achieve, to obtain the torque that we need, it's going to break the bracket. There's no other way. It's going to do like this. So we use TMA in individual torques. I always use TMA for giving individual torques to canines, lateral incisors that are more common to give. We can have other options. Of course we can. We do this. You can use your creativity. You can use your imagination to give other torques. Look like using box loops for that with rectangular TMA arch wire. I usually use that when I have a lateral incisor that is palatally displaced and I want to go forward buccally with the crown, but I want to control the torque. I use that. You can have other options, of course you can. But let's think about the average situation in which we apply the individual torque. Canines and laterals, upper lateral incisors. Canines, because we have in some cases to after we do the traction of the canine, especially a palatally displaced canine, we go buccal with the crown and the root stays in this position. So after leveling and aligning and achieving the correct position of the crown of the canine, we need to adjust the inclination of it. And here is a situation for you to see an example. I did the traction using a cantilever for this, and after this I used the wire, the flexibility of the night tie wire to pull the crown, to pull the crown forward. And I usually use this. I think you have seen some cases of mine using the same strategy to keep the position. I call it an active space maintainer because it keeps giving force, applying force to that point, avoiding the collapse of the space. This is the situation. Look at this. So doing the traction, a palatally displaced canine, doing the traction, and after the canine came to its position, yes, look, the crown now needs to be adjusted in torque. So I use the torque for correcting the inclination of the canine. How do we do that? There are two ways, basic ways to do that. Using two pliers, a male-female plier, adjust to do the torque, or you can use, I'm going to show to you, two plain rectangular wire pliers, 142, the tweed pliers to do that. Here's the most common way to apply the torque. A buccal root torque or palatal crown torque, adjusting the position of the canine, is applied using two pliers, male female. Okay, I don't know how to call in your country, but here in Brazil call them male female pliers for individual torque. If you ask for them in other companies, they probably know what pliers are those. Okay, so this is another situation, applying the torque to the lateral incisor. We have a situation like this, in which the lateral incisor is palatally displaced, and we do the leveling and aligning. And when we do this, the crown of the lateral incisor is going to be a little bit more proclined, more inclined in relation to the neighboring teeth. You already know that proclination is one thing and inclination is another thing. So the inclination is higher than what we want. What can we do for that? Individual torque. And this is the way I usually apply the individual torque. I grab my wire with the reference plier, which is the female plier, and in the position that I did the marks, and then I come with my male pliers between those two marks and I do the rotation. Tip here is grab very firmly your support plier, because it needs a very high force for doing this, okay? And especially when we use stainless steel, but I don't use stainless steel. And I have used for a long time stainless steel, but not anymore, okay? And here we have a situation. Look at this. We have the good aligning of anterior teeth, except this one, which is a little bit more inclined, more flared, buccally flared. And I'm here using, as I usually do, ceramic braces, because I have many adult patients. The majority of my patients, they are adults, and I usually use ceramic. So here it is, and I have the torque being made here. I have two-step bends, two step-up bends for correcting the upper arch, the extrusion of upper arch. This is not an interesting thing to think. Sometimes we use the upper arch correct the overbite, and of course you need to take into consideration the arch, the smile arc, and the possibility of doing this. And in the same part of the arch that is initiating the second bend, I positioned my plier, my female pliers, and I applied the torque in this part here, 1725 TMA arch wire, and wait. In this case, it may take a long time to correct, 2-3 months, even more than that in some cases, okay? So here it is, correcting the torque, and this is the way we apply male female torque. And if you have any doubts in which direction you're doing this, think about the hand that you're applying the torque. Do you want to go palatal, or do you want to go buccal with the crown? Palatal or buccal with the crown? And then look at this. I'm going with the crown palatally. You see, I'm going palatally with the crown. So I grab here my female and I apply distortion in my male plier. And here I'm checking the palatal crown torque, neutral, and the central, and neutral, and the canine. So I need to check, and I need to keep the shape of the arch. Another thing that is important, sometimes we do some bends, and if we don't check the shape of the arch, we may ruin our intercuspation. Take care, okay? Take care. So here we have it before doing the torque and after correcting the torque. I don't remember how long did it took, but probably more than 2 months, okay? Because I can't apply a very high torque in the lateral incisor and in the lateral incisor with a bracket like this. Even though this is a good bracket, it won't resist to this torque, okay? Okay, so now it's correct. I need to keep the correction. Remember that. I always do this. I do the correction, and I don't debond the same month I did the correction. I wait at least 3 months so we have more stability and we have less relapse. Here it is, and here we have the end of the treatment. Everything is completely fine, good alignment, even though we did this traction of the lateral incisor. This is the other way to do the individual torque. We can use 2 pliers to 142 pliers for that. And what I'm going to do now is to do one torsion with the plier distal to the first one, and then I'll position here again the pliers, and distal to this one, I'm going to remove the torque. So I'm going to do 2 torques. Look at this. First one, doing the correction, applying the real torque up. So this is a buccal crown torque. And in this whole segment, we have the buccal crown torque. Now I need to remove it. So in the posterior segment, I'm removing the torque. So having, again, the neutral torque in posterior. Let's check. Here we have buccal crown torque for the upper, of course. And we have neutral here and distal to the individual torque, again, neutral, okay? Let's see it again. I'm doing the torque distal to the first plier, doing the torsion of the arch wire, then I'm running with the plier distal and position it distal to the mark, and now I'm correcting the torque in posterior segment. I can do that by means of doing with the right or the left hand. It will be the same because they are doing opposite movements, okay? So it doesn't matter. And here I'm checking, okay, I'm checking. There are other ways to apply the torque. You can use a reference for that. There are other pliers for that. Those are the 2 ways I apply the torque, okay? With the specific pliers or with 2 142 pliers, tweed pliers for applying the torque. Here another situation, and this is another thing that you must take care. For inserting and having an effective individual torque, you need to insert it inside at the bottom of the slot. You need to force it against the bottom of the slot. And for doing this, you need to go against the torsion of the wire, but you're not doing a permanent deformation when you do that because this is a hard elastic wire. Stainless steel or a training or TMA will keep the form without further inclination, further plastic deformation, okay? So you did a torque and you can go a little bit against the torque and insert it inside the slot. Look at this. So it's completely outside of the slot. And for inserting, you need to do this maneuver so we can do this and insert inside the wire. Okay, look what I want. And I usually use a specific pliers for that, the Wayne guard, because of the tip, because I want to see what I'm doing, and this is what I do. But you can use 139, you can use other pliers for that. I usually use this one, okay? This is a Wayne guard plier. So you see, insert it inside the slot. Another case, same situation, traction of the canine, first opening the space, then doing the traction of the canine, okay, opening, and when I have enough room, enough space, I will remove the deciduous canine, the primary canine, and I will start with the traction. Here it is, and when it is palatally displaced, it comes. I like when the canine is palatally displaced, by the way, because of the gingiva. And when we have it in opposition to this situation, when we have it buccally displaced, sometimes during the traction, during the movement, the crown of the canine and the bottom that we put in the canine, it will tear the gingiva and it will appear in a higher position, which can jeopardize the beauty of the gingiva and the attached gingiva to attach to that position, okay? So I prefer when the canines are palatally displaced. I think I have a better outcome in relation to the periodontal status. And here we have it. After opening the space, I'm doing the traction using the flexibility of the night-tie arch wire for that. And when I reach the rectangular arch wire, I will apply the torque. So from this view, you can see that because of the line of action of the force, we have the crown going forward and the root is going in the other direction. And after reaching the right position, we have a wrong torque. And now we need to apply the right torque for correcting this. So when I have the chance, I will finish the aligning. And when I reach the rectangular arch wire, now I can apply the torque. Look at this, TMA 1725, always the same. And for applying a good torque, inserting inside, really, truly inside the slot, and then tying it to the wire with, to the slot, to the bracket, tying the wire to the bracket with steel ligature, okay? With steel ligature for being more effective. Same thing here. What I want to apply is a palatal crown torque. So I'm doing this. I'm going to change the inclination towards palatal, the crown. So this is the way I see the torque. Lingual, buccal, palatal. Buccal and palatal, okay? So this is how I see. And then I'm checking. And then the same way I do when I apply a torque for segment, I will see if the torque is all right. I will do the test. And I will insert inside the bracket. I want to change the inclination and see in what position the other part of the wire is passing in relation to the center of the brackets, to the center of the tubes. And in this case, when I go up with this one, with this part, I will apply a couple here that is going to generate a moment, the moment of the couple, that is changing the inclination of the crown palatally, crown palatal, and root buccal, okay? This is the individual torque. That's it. That's it. Not that difficult, of course not, but you need to be always paying attention to these topics, to these points. The flexibility of the arch wire, don't do that with stainless steel. You'll have a very high force and sometimes you'll break the bracket or even open the stainless steel bracket because it needs to be a high force. Yeah, it needs, but with stainless steel is too much force, too much force. And here it is. What we are really doing is, because of the torsion, we are generating a couple, and this couple is giving to us the moment, the beautiful moment of the couple that is changing the inclination of the tooth that we want, because this is an individual torque, okay? So the inclination is going to be changed because of the couple, the moment of the couple. And that's what we expect to happen. Problems here. A very high torque will impose in the neighboring teeth other type of torque, the opposite torque that we are applying in the teeth and the tooth that we want to change. So take care. With very high torques, we have some bad outcomes. So wait. Torque takes time. Wait and see. You don't need to do that at all times. Your patient come back to another appointment, okay? You just check, and torque is there. If it is there, give it time. Give it time to express itself. Okay. Well, and another case, the same condition, and in this case, because of the position of the tooth, it was buccally displaced. You see what I told you before? In this cases, well, sometimes we have this bad outcome. I don't like that to happen. Of course, it's not what I was planning for. And suddenly the bottom may tear the gingiva and it will appear in the mouth. This is the active space maintainer. It's not maintainer, it's much more like a regainer. We're giving the helixes and 90 degrees, other helix. And when it goes inside the space, it goes forcing the neighboring teeth against to open the space a little bit more. Because when we apply the force, it will happen the opposite, okay? We'll have a moments here, the moment of the couple, intrusive force, and we are closing the space. This is something that will prevent it to happen. So it goes to its place, and after this, we may need to apply the torque to correct the position. In this case, a buccal crown torque, not a palatal, but a buccal crown torque, and a lingual or palatal root torque, okay? Because it was buccally displaced. So it's quite the opposite in relation to before, what saw before. And for finishing, well, we may need to apply torques like this, individual torques, for the finishing phase of our treatment. But what is more common for us to see or not see, because we don't see this view of the occlusion unless we are doing casts for finishing. We mold our patient for that, or we scan our patient's mouth. That's what we've been doing for a while, and this phase of the treatment. And sometimes what we see something like this. So we have from a buccal view a good position, sagittal position, but we don't see the correct torque. We don't have the correct torque. We don't have the good settlement between the upper cusp and the lower fossa. So for doing this, for correcting this, we usually need to apply a buccal crown torque in posterior segment of the lower arch. Not in the upper. Why not? Because it's more common to have the problem of inclination in the lower arch in comparison to the upper one, okay, to the upper arch. So this is what we see in these cases, and what we are going to do here is 2 equal torques applying a buccal crown displacement, a buccal crown torque. So we have other situations, of course we do, but this is very common. And when we don't pay attention, this is probably something that will make the occlusion unstable. We don't have a good settlement between the cusp and the fossa. So here is neutral. I don't want neutral. I want an active. This is passive. When I have a good position, or I have a gap, I have the plane side the slot that is not applying the correct torque. So I need to do the torque, the real torque. So the relative torque is going to do the job for me. The relative torque in the direction that I want. Look at this. So this is the buccal crown torque in the lower, for the lower arch. Look at this. Pay attention, buccal crown torque. And I'm checking. I go to one side. It's good. To the other one, it's good. So if I don't be afraid of applying this. Don't think you're going to generate vertical displacement of the crowns. I showed you before. This is not going to happen because the arch wire is engaged in all brackets, so it's going to be neutralized, canceled, and you're not going to have vertical components. And if you had the occlusion for preventing that, so don't be concerned about it. It's going to be all right, okay? And this is, okay, good torque, symmetrical torque, buccal crown torque in both sides, and just wait now. Couple is here, the couple is here, and the moment of the couple is there. And I want this to take place, the inclination being corrected, okay? Take care. Look at this and stop the torque when you achieve the right movement. Then you put the passive torque to keep, intercuspation elastics to keep for 3 months, and you have stability. That's it. Here it is, before checking the torque, and now we have a good intercuspation. Keep it in position for 3 months, intercuspation elastics, and stability. Okay, guys, so that's it. This is all about torque. All about torque is this. I love to teach torque because in my routine, I apply that a lot. I apply torque a lot. Why? Because I need to do the retraction. I need to control the inclination of posterior teeth. I need to give individual inclinations to correct bad positioning of some teeth or some tooth. And in this case, in a specific tooth, and in this case, I need to know about the torque. So in this course, you've seen everything about torque. But for understanding better what to do with torque, you need to focus on the biomechanics. Understanding better what you need in biomechanics, you need to focus on diagnosis and treatment planning. So don't ever forget the need for closing this circle. Diagnosis, treatment planning, and biomechanics. And then the torque is inside it. The torque is one of the most important things when we think about biomechanics, when we apply the correct biomechanics. So guys, this is really something that I love to do, to teach this type of mechanics, the individual way to see your patient, not relying on the prescription, not relying on companies. We must do that by ourselves, understanding the problem and applying the right solution for that problem. Okay? It was a great pleasure to be with you. I have these other courses if you want to know more about diagnosis, treatment planning, and the whole thing about biomechanics. And I'm here for you. See you guys. Thank you again. Bye-bye.